Good morning, Bespoke Babes. It's Dr. Kim. This morning, I want to talk about how to treat sunspots. So yesterday, I posted how to recognize a potential skin cancer or when a spot is worrisome. So today, let's talk about how we're going to treat it after you have already had your spots evaluated by a medical professional and you know for sure that none of your brown spots are actually skin cancer or concerning for skin cancer. So we have several options to treat brown spots. So first of all, the medical professional needs to rule out any possibility of skin cancer, as I said, or pre-cancer. And then we need to determine, are your brown spots because of the sun? Are they because of post-inflammatory hyperpigmentation? Are they melasma after babies? What exactly is causing these spots? And then we can figure out the best possible way to treat them and the aftercare to keep them gone. And of course, you know I'm gonna say, as always, everyone needs to be wearing their SPF, regardless of the cause of your brown spots, SPF. So our first option is going to be a topical treatment option with one of our skincare products. And what we're going to pick, again, is going to depend on the specific cause of your brown spots. So we may, if you have post-inflammatory hyperpigmentation, we may want to go with our anti-age brightener. This has tranexamic acid in it, which is amazing for post-inflammatory hyperpigmentation and melasma. This is a product I actually use every single day on my skin to help keep brown discolorations away. Or we may go into our Vivier line. Vivier has an entire hyperpigmentation kit. It has 8 products in it, and it's a kit of products that is really aimed at diffuse hyperpigmentation, sun damage, lots of brown spots, and you're going to use that kit for about 12 weeks. You have to think of it like a topical treatment, not skincare. Or we may want to go into one of our custom serums and pick some of the ingredients that we know are really great for getting rid of brown spots, like for instance, kojic acid, arbutin, our niacinamide B3, maybe a little azelaic, and of course, our old friend, vitamin C. All of those ingredients are helpful at getting rid of brown spots, depending, of course, on their cause. And with the Universe Skin line, I can pick which ingredients to put in there to really target your brown spots. It's important to remember, if we're going after browns with topical treatment, it's not something that you're gonna notice the difference immediately. It's not gonna be overnight, and we have to wait for your skin to cycle through. It's gonna be a good 12 weeks-ish before you really start to see those changes in your skin with any sort of topical skincare. So then our next option is our M22 Intense Pulse Light treatment. IPL uses, as I just said, intense pulse light of different wavelengths that are focused at different depths in the skin and different targets. So we are gonna pick, depending on your skin type, either a 515 nanometer, maybe a 560 nanometer wavelength to target the brown spots. This is a series of treatments, anywhere from 4 to 6 treatments, depending on how deep your brown spots are and how many. It feels like an elastic band going snap, snap, snap against your skin, and then it feels warm like a sunburn for half an hour or so afterwards. Really, 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 really important that you're out of the sun after an IPL treatment, and we can't do it on tan skin or sunburned skin as it's too risky. All of your brown spots look much more brown before they're less brown with our IPL, and they're gonna just flake and peel away over 12 days after your IPL treatment. IPL is great to target those brown spots, and we also know that repeated use of IPL on a yearly basis can actually help maintain the collagen in your skin. So I do a few IPL sessions a couple of times a year. Our next option is to do a Jessner peel. So a Jessner chemical peel is using a combination of lactic acid, salicylic acid, and resorcinol to peel away that outer surface of your skin. Depending on the number of layers that we put on, we can go deeper or more superficial. The advantage of picking, say, your Jessner peel over your M22 is that because it's taking the entire top layer off, we can also target texture changes and fine lines, as well as decrease oil production. So whether we're gonna go with a Jessner peel or the IPL depends on your skin type, the type of brands that you have, and the other skin concerns that you may also want to address. And then finally, of course, our Fotona Big Boy Laser. Fotona is amazing because it's really, really adjustable. So I can do a very aggressive peel, I can do a light peel, we can target browns, we can target reds, we can do pores, texture changes, wrinkles, fine lines, deeper wrinkles, acne scarring. The Fotona is very, very adjustable, and I absolutely love this treatment. So again, depending on what your specific skin concerns are, if it's just browns, if it's browns and reds, texture changes, wrinkles, we're gonna pick one of these options. Our downtime increases as we go down the list. So if we're doing an aggressive Fotona resurfacing, you can have a couple of weeks of downtime with that, where you're very red and healing. Of course, with our topical treatments, no downtime at all, and then in between with our M22 and our Jessner peel. So lots and lots of options to treat brown spots and discolorations on the skin. As always, if you have any questions, make sure you post them, send us a message, and I'll answer them for you. And as usual, if you have any other ideas or questions that you want me to answer in a video, make sure you post them, and I'll do that video for you. Have a great day, Bespoke Babes.